Hello. Hello, everyone. I hope you're having a fabulous day. I am Dr. Leslie, your board certified emergency physician, best-selling author, international speaker, and professional photographer. And I am here today with another episode of 2 Minute Emergencies. So, today's topic is something that you may learn a lot from. Today's topic is malnutrition. And why? Because this is Malnutrition Awareness Week. Now, when we think of malnutrition, we think of those pictures of children who are very thin, have no energy, are short in stature due to growth retardation, and who have these enlarged abdomens. That's what we typically think of with malnutrition. We think of the extreme cases known as starvation. Well, in actuality, malnutrition is a whole spectrum of, of degrees. So, here in the United States, malnutrition is a tremendous problem. It is a combination of things because you have people who are not getting sufficient caloric intake, are not eating the proper nutrients, but we also have a lot of children that are affected. And in the US, 1% of our children are actually malnourished. 1%. And I know we've been doing a lot through the years as far as providing school lunches for children, and in some cases, even providing food for them to take home. But it is still a problem that we all have to deal with. So let me talk a little bit about the types of malnutrition. As I said before, it may include a lack of calories, lack of protein, lack of carbohydrates, as well as lack of fats, vitamins, and minerals. Now, why is this so important? Well, our body needs all of these things together in order to maintain a balance. And that balance may be to keep your hormones in balance, to generate some of the enzymes that we need. All of these are so important. And if we are thrown off on any which way, we can affect ourselves in a lot of ways. Now, there's been a lot of diets, and it may be low carb diet, low protein diet, low fat diet, low this, low that. It's good to try to lose weight. Absolutely. I'm going to talk about more of that in just a moment. But it's a way of doing it in a healthy manner. It's not just a matter of all of a sudden saying, I'm not going to eat my 3 meals a day. I'm just going to eat 1 meal a day and I'm going to eat 500 calories or less. With the exception of those patients that are prescribed that by their physician, not the way to do it. You're ultimately going to cause harm to your body. Yes, you'll lose weight, but you will definitely fit into the category of being malnourished. So we don't want to go there at all. Now, when we also think about it, we think of malnourishment as being a lack of high quality food. So our diet has become so filled with fast food, junk food, grab and go items. We're doing our bodies a huge disservice because often we're suffering from malnutrition. We don't think about it. It's like, I live here, I have money, I can afford to eat whatever I want. But are you eating the right things? And then I'm going to jump over to the other end of the spectrum. You can be malnourished and be obese, morbidly obese, or overweight. Still be malnourished. Because once again, if you're not eating the proper diet, you can be malnourished. It doesn't matter your size. So we don't think about that because we're like, oh, they just overeat. They have no problem. Not correct. So one of the things that we need to think about is our children. I'm going to go back to that again. How can we, first of all, how do we know they're malnourished? Well, there's a lot of different signs. I mentioned them being small for age. I mentioned them being underweight for their age. Very important signs. But they can also have other things like skin changes. Their skin may be dry and thick. They may actually have a swollen or thicker tongue. They may have hair that's curly. Now, obviously, I have curly hair, but it is hair that easily is pulled out. Okay? It's not very strong at all. They can have brittle bones. And one of the ways of testing these things are, of course, doing nutritional studies, finding out what the child or patient is eating, but also in extreme cases, doing things like bone density scans and looking for different GI tract or gastrointestinal illnesses that come along with malnutrition. So what if you have a child that is just a picky eater? There are ways around that. First of all, as a parent, we may figure out how to do things a little bit sneaky. So mixing healthy food in with the food they like the most. So say you have a child that doesn't like to eat vegetables, but they like mashed potatoes. Why not mix some cauliflower in with the mashed potatoes? Same consistency. Okay, you want to call it cheating? Maybe it is, but the children will never know the difference. Things like making smoothies for them. A nice fruit smoothie, but you add a little bit of spinach in it. It's green, it's fun. The other thing is making meals themselves fun. So children often take their food to school, they take their lunches, and you pack what you think is healthy. But your child isn't eating it. They're throwing it away. They're trading it with a friend for something that's quote unquote fun. So play with designs and shapes with the food. Make smiley faces out of things. Make them look pretty. And another way of doing it is actually making your child involved in the whole process. So whether it means them going to the grocery store and you working together to pick out healthy food, whether it means planting a garden and they're able to pick some of the things right out of their own garden to eat. If you can grow carrots, awesome, absolutely incredible. Also allowing them to be part of packing their lunch. You may be trying to do it quickly to get the child out of the door as fast as you can so they don't miss their school bus, but involve them in the process and they're more likely to eat what you give them. So this can make a huge difference in keeping our children healthy and able to focus on their studies. Other things we want to think about is, as far as for ourselves, you can actually have a increase or have too much vitamins. You can take too many vitamins. Now, many of the vitamins that when our body has too much, we literally just urinate them out. But you can actually cause problems in absorption, etc., if you're taking too many artificial vitamins. So we're talking about supplements, things like that. The idea is to get all of our nutrition, vitamins, minerals from our food. It makes all the difference in the world. So I hope you found this helpful, and I hope you realize that you need to take a look at your own diet and make sure that you are not malnourished by eating the wrong food or not providing yourself with enough. So that's my tip for today. This is 2-Minute Emergency. And once again, I am Dr. Leslie, your board-certified emergency physician, best-selling author, international speaker, and professional photographer. And I bring you these tips to help keep you healthy, safe, and out of the emergency department. Until next time, take care, be healthy, and be safe. Bye for now.